Ambassador Tingen, welcome to the talk. I'm Dr. Abdullah Mohammed. I'm from the Moderne, India. We work with different issues and we try to strengthen the relations between India and Norway. So thank you so much for being a part of our talk today. We're going to address quite a few issues that are very, very important, both with regards to the situation that we are in today and on general basis.
I'm very pleased to be here today with Modern India.
So could you please briefly explain to us what health diplomacy is?
Yeah, health diplomacy in many ways is a rather new term, and it's actually can have two different meanings. One is that we increasingly understand that we need more diplomacy to actually resolve health issues internationally. So we need the diplomatic arena, we need diplomats to sort of negotiate, to find good solutions. Of course, bridging the health experts with the more general policy experts and diplomats. So those arenas would be the World Health Organization, they could be the Human Rights Council, they could be the UN General Assembly in New York, just to mention a few. But in addition, you can also say that we have diplomacy, or this is diplomacy for health, but you can also say that you have health for diplomacy. So actually to have health as a platform to strengthen relations. That could be relations between Norway and another partner, or it could be using health interventions and actually improving health conditions as a way to reconcile conflicts and relations between different actors.
So what made you accept the job as Norway's first global health ambassador? And if I also may ask you, what's the most rewarding part of the job and what is the most challenging?
No, thank you. So in a way, I follow actually in the footsteps of giants, in the sense two former employees, staff at the foreign ministry. We had Sigrun Møgedal, who was the AIDS ambassador, so in a way a smaller portfolio, but still very important in the early days of the AIDS epidemic, and when we really took action after the 2000s. And then it's the well-esteemed Tore Godal, who headed the tropical disease program of the World Health Organization, and then went on to establish Gavi, the Vaccine Alliance, and he also had a similar role at the Minister of Foreign Affairs. So even if I'm the first with this title, and where this is sort of formalized as a mandate to work on global health policy issues and to handle the ODA, overall portfolio on health, I definitely follow in footsteps of others, and of course it was a great honor to be offered such a position, and of course in particular in the times we are currently experiencing with the COVID-19 pandemic. So I guess that was a very key driver for the Minister of Foreign Affairs and the Minister of International Development when they jointly decided to establish such a post. Yeah. And of course, challenges, yes, we have challenges these days, definitely. Of course, the challenge is on the ground. It's related now in particular to access to COVID-19 technologies, so vaccines, test, diagnostics, but also to alleviate all the sort of additional burden that COVID-19 causes in societies. The challenge is also actually how to work on this in a more or less locked down world. We cannot have the normal tools of diplomacies where we actually meet in larger meetings, but also do a lot of sort of real work bilaterally and in corridors and outside the formal meetings. Those are much more difficult to actually use now. So it's also a challenging time of actually working internationally.
Because we need to get through to the people and contain epidemic and make situation better. And often we do not know how the course of time will take us. So this is, I understand that this must be quite a big of a job to work with. And now talking about a little bit shifting the focus to the challenges that India could face as a part of the massive COVID-19 vaccination drive that they're going to plan within the months ahead till the summer. They aim to vaccinate about 300 million people by July. What's your perspective on this? Do you think this is realistic?
So India, I think, has the means to actually do this. A lot of expertise, of course, a specific expertise on vaccines and vaccine manufacturing. And it's really important for the world that India succeeds in doing so. India constitutes, as a population, I think more or less a third of the total population that is within the so-called, I would still call them so-called low and lower middle income countries, and who will be supported by the COVAX facility in getting access to vaccines. So actually, for the world to succeed, India needs to succeed. And I think India has now mobilized their capacities, their technologies, including the IT expertise in India to really set up this vaccination program. So it's, of course, it's about having the vaccines, but it's also about having the capacity for those vaccines to reach all around and the most vulnerable. Because, of course, these 300 million needs not to be just the general population. It needs to reach the most vulnerable, the elderly, the ones with other diseases who have the highest risk of contracting serious COVID-19.
Right. So one thing is to manufacture the vaccines and help and set an example in the area where India is placed on the planet. But what other role do you see for India to sort of be there for the world with regards to the pandemic situation?
No, India is in many ways the vaccine factory of the world. If we really look at scale and look at the number of vaccine doses produced every year, it's the majority is actually produced in India. If you look at the markets in low and lower middle income countries, India is probably producing 90% of the vaccines used in the world. It's for the children's vaccination programs all around. It's for the vaccines purchased by UNICEF and partly then also paid by the Gavi Alliance. So that's why it's been really important now that Indian vaccine companies have engaged fully in both licensed production of vaccines that are being developed in other countries. It includes the AstraZeneca, so-called Oxford vaccine, also from the UK, of course, and then the Novavax vaccine from the US. So the Serum Institute of India produces that under license now. These vaccines will be really important for the global efforts. But in addition, Indian companies have also started to develop new vaccines and to, of course, do those partly based on sort of standard classical technology, so the so-called inactivated vaccines, but also actually some more newer innovative vaccines. So I think this is really key for contributing globally to actually have sufficient number of vaccine doses.
Yeah, even though India plays such a nice and important role on the world stage, it really is also important to speak about the multilateralism where the whole world revolves around so many countries, from Fiji to Alaska, to Canada, to South America, to Russia. So speaking of multilateralism versus the individual national interests, how do you think the international community finds the balance between the imperative of protecting the health and well-being of their own populations and the moral obligation to help the developing or underdeveloped countries to fair and equitable access to the vaccines? So because I'm thinking in such a big pandemic from which we have learned enormously in the past year, nobody wins the race until everybody wins the race. So, and we have so many different socio-economical inequalities between these countries and standards between these countries, level of education, access and the healthcare network. So how do you think this challenge would be met?
I think we are actually now in a very difficult sort of moment in many ways. We know that approximately 40 high-income countries have started rolling out vaccines. and we know that the majority of countries in the world have not. And I think that difference is, of course, a challenge. It demonstrates inequities. Inequities are drivers for unrest and actually conflicts potentially in the longer run. So I think we need to have that sort of bird's eye view on the situation. In Europe, we've had, I would say, a bit too narrow debates on vaccine access over the last month. There has been criticism in several countries because they see that neighbor countries or some other countries further in the south have managed to start vaccination much faster than, for instance, Norway or Germany, to just make some examples. But I think that quite small difference, and now in the early days of vaccine rollout, really does not matter if you see it in the full picture.
Yeah.
Having said that, I think it's, of course, as you said, really important that countries and governments and democratically elected governments, of course, has an obligation, first and foremost, to protect their own citizens. So that needs to be taken care of. The challenge is that protecting their own citizens is also now about protecting the world, because a pandemic crosses borders. A virus cannot see any borders. To really have an impact internationally on controlling the pandemic, we need to use the limited number of vaccine doses wisely and try to make sure that we can distribute them equitably. So that means that it's important to start rollout everywhere and actually first address the most vulnerable and those at highest risk. Having said that, I think the only solution to this problem and this challenge is to increase supply. We need to increase the number of vaccine doses being produced. And then again, back to India, I think to use the large-scale manufacturing capacities of middle-income countries like India, like Indonesia, like South Africa is key. And it's therefore very important that the big vaccine companies actually use those capacities, enter into partnerships with local manufacturers in middle-income countries all across the world to really boost production, because that is the only way. Instead of trying to have tough debates on dividing a small cake, we need to sort of expand the pie and make sure that we can produce sufficient numbers to vaccinate the world.
Yeah, but is there any other priorities that you think Norway's global health efforts should focus on once the pandemic is a history?
No, it's actually, even before it's a history, I think it's important to understand that all resources we have always have an alternative sort of use. So we need to make wise decisions on how we prioritize and where we make the biggest efforts. Of course, in a pandemic, that has to be a sort of a first priority. But at the same time, we need to understand that even the indirect effects of closing down health services, diverting resources to COVID-19 instead of other important health programs is actually also causing a lot of ill health and disease in the world. So I think first we need to make sure that we can have a balanced approach to supporting health systems and health capacities, in particular than in developing countries, now also during the pandemic. And then after the pandemic, of course, it's about recovery, it's about leaving no one behind, it's about ensuring sustainable development and sustainable growth. And I think we see now in the pandemic how important health is to people, to citizens, to the politicians. And I think the SDG 3, Sustainable Development Goal 3 on health for all, is a key part of the overall sustainable development agenda. So our approach from the Norwegian government would be to try to sort of foster an integrated approach to development, making sure that we can support countries, but also support countries in gradually taking the sufficient ownership domestically on establishing welfare systems, health systems, establishing so-called universal health coverage, where actually governments do prioritize their own resources and do prioritize the health interventions and services that have the biggest impact. This is key. And back to India, as we know, India is now on the path towards a universal health coverage system. It's a challenge, of course, in one of the world's biggest countries, but it's really important. And I think we see also in the pandemic how countries who have universal welfare system, universal health systems, where actually there's not the difference between rich and poor within the country in the support you can get, they are also the ones who tackle the pandemic the best way, because then people can follow quite strict guidelines on needing to work from home, or even maybe not having your job for a period, because you have a safety net that can take care of you. And I think actually to have that basic safety net, it's about health, it's about education, it's about social welfare and income guarantees in some levels, is a key policy domain for all countries. So of course the sustainable development is about the social dimensions, which I mentioned now in many ways, but understanding that the social dimension is really as important as the economic dimension, as the environmental or climate dimension of sustainable development. I think that's a key message that we have learned and understand currently.
Yeah. And India, like you said, has enormous infrastructure when it comes to health services, and also surplus amounts of qualified health personnel. While Norway is among the best in innovation and research, among others, cancer research, for example. So in what aspects of health sectors can we expect more bilateral cooperation between both India and Norway?
No, I think India has a lot of expertise to offer, definitely, and have a lot of solid educational institutions within health, but also within the wider, so within medicine, I mean, but also the wider health domains, as well as biomedical education. And I think, in general, increasing international collaboration is important to actually innovate more and become more efficient, to find solutions that are better than the ones we have today. Norway and India has had a specific partnership on health, the NIPI program, for some years, which has been important and I hope can continue in some way. That has been focusing in particular on making sure that healthcare can be provided also in the most rural areas and among the poor in India. But India is a vast continent, and it's sort of with situation like the most sort of deprived countries have in some areas, in some population, but at the same time, as you indicate, the expertise and knowledge that is at par, at least, and maybe even more with Norway. So I think we need to understand that sort of the large sort of spectrum of capacities that India has, and that we should, to a larger extent, see where we can find common ground. India is also strong, as we know, on the ICT sector, and of course many Norwegian companies have seen that opportunity for collaboration and for also, of course, a large market.
Yeah.
India is a large market.
Because there is also successful cooperation as we speak between India and Norway on other sectors that I can see: IT, exchange of personnel, in the banking sector, and other software technology sector. So I hope to see such development also with regards to cooperation between these two countries with regards to health sector. Or do you think this could be real? This could be possible?
Absolutely, and as we know, the important innovations in the healthcare sector now coming forward in the sort of coming years is really linked also to the integration of IT and health sort of understanding, artificial intelligence, integrated services that can sort of really analyze the information, the data that we generate in the health system, and not in a way, complement clinicians, not do without them, but actually complement the knowledge and the insights of clinicians, I think would be important. I think Norway has a modern health service, definitely, but we still have a way to go to actually really use those technologies.
Right. And together we can be stronger.
Absolutely.
Yeah. Thank you so much for your participation, and good luck with all the efforts. And there's no other time than now, which really is important that you continue with exactly the focuses that you have and you work with.
Thank you so much, and thanks for being here.